lip plumper and get a lip flip like lip filler couldn't. The amount of money you would have to spend, the amount of syringes you would have to use to get this look.
You never want your top and bottom lip to be 50-50. Never.
Today I'm going to share with you something very special on how you can plump your lips naturally, where you can look half your age.
You want to enhance your lips, and I'm here to help you. I know it can be so confusing to try to navigate through videos and decide which treatment is right for you. There are lip flips, lip filler, and do these exercises this guy's saying really work? Can you really get fuller lips and look half your age by doing facial exercise? I'm going to share my tips and my response to key moments in these 3 videos that are all about lips. So let's dive in.
Filler had it in like my cheeks here for the contour, like make the cheekbone look bigger, jaw filler, nose filler, obviously cheek filler, lip filler. I'm like the filler veteran.
The thing I love about Alana is that she shares a lot in her videos. I love that she's very honest and open with the public about what she gets done. Since celebrities aren't honest about what they've had done, it's nice that a YouTuber with her large following can share all the treatments and even surgical procedures that she's had.
I got lip filler for the first time years ago. This is me in the car on my way there, and I'll show you what they looked like the day of. They were swollen, but I kind of liked them like that. I'm sorry, but this video was taken a month after I got my lips done with filler. And like, does this look like it's worth hundreds or thousands of dollars depending on where you went?
So when you get lip filler, it enlarges your lip tissue.
But filler doesn't work on the muscle, so her lips continue to curl in or invert when she smiled.
So in her specific case, she fell in love with a lip flip because it prevented her upper lip from curling in and hiding when she smiled.
If you're gonna get lip filler and you spend hundreds or thousands of dollars to get thicker lips, it's kind of pointless to do that if when you talk and when you smile, that top lip is disappearing.
Agreed. That's why I tell my patients they can benefit from a lip flip if they have a gummy smile or if their lips curl in and hide when they smile. A lip flip is great even if you get lip filler.
Use the lip plumper and get a lip flip. I think the lip flip is like $200 or something. That's the better option to me.
This is where I have a difference in opinion. I understand that she feels that a lip flip was more beneficial to her than lip filler, but we can't give cookie cutter advice to everyone.
Cookie cutter advice is when the same approach is advised and not enough attention is paid to individual differences. I love and appreciate diversity of faces, and since everyone's lips aren't the same, every treatment isn't going to enhance somebody's beauty in the same way, which is why the "this is what I do, so you should do it too" type of advice isn't going to work for everyone. Alana's lips inverted when she smiled. If your lips don't really invert or hide when you smile and you do a lip flip, it may not work well for you. I did a lip flip on this patient and her upper lip doesn't invert. It actually everts or curls out when she smiles, and she doesn't have a gummy smile, and she didn't have noticeable results, as you can see.
Also, not everyone can tolerate the weakening feeling that comes with a lip flip. If you are a vocalist or if you scuba dive and need to make a tight seal, this treatment may not be a good fit for you.
Like lip filler couldn't.
Not true, a lip filler can and is very beneficial to many people. Let's take a look at who can benefit from lip filler.
This is a lip thickness density chart that I created to help people determine if they may be a good candidate for lip filler. You have type 1, very thin, 2 thin, 3 moderately thick, 4 thick, and 5 very thick. Alana has a naturally fairly full lip size. Maybe she's a type 3 on the scale when she's not smiling. If you have thinner lips, type 1 or type 2, and maybe even 3, you can most likely enhance your appearance with lip filler.
I feel like $200 and a lip plumper is better.
If I could mitigate putting on so much lip liner, it would just make my life easier, the efficiency of it, but then also, you don't have to worry about when you go to dinner, constantly reapplying your lipstick, lip liner to have that look. So it was just a no-brainer for me.
A lot of my patients don't want to have to rely on a lip liner or lip plumper. The beauty of lip filler is that you wake up with your results, which can last months or years, and you don't have to be dependent on a topical product that maybe lasts 8 hours. I think Marie did a great job reacting to Sacheu's video, and I agree with her on a lot of the points she spoke about, especially migration and the importance of finding the right injector. But there are a few things I disagree with.
Especially in the top lip, I really like a big top lip, which might not be a popular opinion. People like to do the 50-50, but I just like a big top lip, but anyway.
The objective of fillers is to enhance your natural beauty, not change them.
I do agree that whenever I treat patients, I'm not necessarily trying to completely change their natural upper to lower lip proportions, but I do disagree with this statement.
You never want your top and bottom lip to be 50-50. Never.
It's rare, but some people's natural upper to lower lip ratio is 50-50, meaning naturally, without the use of a lip flip or filler, their upper lip is as full as their lower lip.
Meaning naturally, without the use of any Botox or filler, their upper lip is as full as their lower lip. While most women's upper lip will be smaller than their lower lip, this is not the case for everyone, and this is why it's so important to appreciate individual variation.
Naturally, your bottom lip will always be 2/3 bigger than your top lip.
Not true. Everyone does not have this ratio that she's referring to.
It's more common for people of Caucasian ancestry to have the ratio that she's referring to, in which the upper lip constitutes about 1/3 of the total lip volume and the lower lip constitutes about 2/3. However, other ancestries such as East Asian and African can have different ratios in which the upper lip can be closer to the size of the lower lip. In African ancestries, the upper and lower lip volumes can be frequently nearly the same size or close to a 1-to-1 ratio.
I've actually come across people of Caucasian ancestry who have a 1-to-1 upper to lower lip ratio. A lot of my patients who come in to get lip enhancements want more of a 1-to-1 upper to lower lip ratio, and I just didn't want anyone thinking if they have this ratio that it's somehow not the norm. Studies show that people actually find this ratio very attractive.
Lip fillers will last 6 to 8 months.
For someone who had lip filler for the first time, maybe it'll last 6 to 8 months, depending on how much volume they got injected and how fast they metabolize the filler. But what you'll find with retreatments after you've been getting your lips done for a while is lip filler can last longer. It can last for a few years. I've had patients that couldn't get lip filler while they were pregnant and breastfeeding. A year and a half goes by and their lips never went back to baseline. But if your lips have been over injected, it can take years for your results to go away.
Doing the lip flip, the results are very, very minimal.
I wouldn't say the results are very minimal. I've had some pretty amazing results with a lip flip.
If you want to get some lip flip done, it's only $40. Which is crazy, right? But now let me explain to you why it's so much cheaper. First of all, when it comes to Botox, we pay per unit. So basically it's $10 per unit. To do Botox in your lips, I only use 4 units.
Perhaps this is why she feels the results are very, very minimal. She mentioned she only uses 4 units. I've been treating patients with lip flips for years, and I'm a big fan of the lip flip. I've been treating myself, and I almost never use 4 units on anyone. I feel that it's just not enough to give noticeable results.
You will be experiencing a harder time drinking from a straw, speaking, rinsing your mouth for 6 to 8 weeks.
The weakening feeling from the lip flip usually doesn't last 6 to 8 weeks. It usually lasts about a week or 2, and people get used to it. As you do more lip flips, you'll find that you don't feel the weakening feeling as much. I don't feel it as much as I used to, and that's because I've been doing lip flips for over 10 years.
When we are injecting lips, never inject more than 1 ml at a time. If you are thinking of getting them done and you go see a nurse or a doctor and they recommend that we start injecting 2 mLs the first time, that is a red flag.
Completely agree with this. Never inject more than 1 milliliter at a time. Most of the time when I'm treating lips, and not the tissue around the lips, just the lips themselves, I'm usually doing less than a full syringe.
So after you do get lip fillers, your lips will be swelled. Typically, it won't last more than 72 hours, I would say. Some people, it even goes away after only 24.
Agree. If you have natural looking results, swelling won't usually last more than 48 to 72 hours. I find that people that I've questioned who have unnatural looking results, when I ask them how long they had swelling for, they usually say about a week, 2 weeks or more, possibly even a month. So if it's been 3 days or longer and there's still apparent swelling, there's a chance you may end up with unnatural looking results.
So which one do I prefer? I definitely recommend getting lip fillers. Yes, I know the first thing that a lot of people think of is the price, but that's not the only thing you can think of. It might be a little bit more expensive, but it's worth it.
Her final recommendation is a lip filler over a lip flip. And again, the whole thing with personalization of treatments and individual variation. I have patients who are very happy with just doing the lip flip, including myself. I've not done filler yet. I have patients who are happy doing both. It all depends on the individual, what type of lips they have, and how they behave in motion.
Now let's focus with that orbicularis oris muscle, that kissing muscle. We're going to put it through that pursing action. We're going to send kisses out into the universe for 30 seconds. That's going to plump those lips up. So you'll do this for 30 seconds.
Some people really do want to believe that this works. If only we can exercise our faces to looking younger. In the aesthetic industry, we know this doesn't work.
Our lips age because we lose collagen and elastin in the skin. If you exercise your facial muscles, it's not going to stop your skin from losing elasticity.
Furthermore, if exercising the orbicularis oris muscle that surrounds our lips, will result in plumping your lips, why would treating the air with Botox cause the upper lip to look more full and decrease the lip lines? If anything, that's doing the opposite of exercising. That's weakening.
Bodybuilders are very physically fit, but as you can see, even though they are muscular and they regularly exercise their muscles, you can see the skin has still lost elasticity. If anything, overuse of this muscle would cause more wrinkles.
A lot of my videos are backed up by real before and after photos and videos of real patients that I've treated with either lip flips or lip filler. And if you want more information on these two treatments, be sure to check these videos out, and I'll see you in the next video.